Thank you for having us here. I think it's a privilege to speak to at NASSCOM. So I will just quickly share my screen. I have a couple of slides which I want to uh, show all of you. I'm finding it hard to share. Let me just talk about Wysa instead. So Wysa has actually we set this up in 2017. This was when my co-founder and wife, Jo, reached out to me and said that she was sinking into depression. And we actually looked around and we found that whatever was out there was very fragmented. It was very hard to access. It was expensive, and we decided to build something up for our own. And what we realized is that when we did that, this grew to a stage where now
Ramakant,
it is helping many.
little less voice from your side. It's little low. Probably you may like to increase your volume. Thank you.
So is this better?
Perfect.
So and basically what we did was we created Wysa as an early intervention for mental health support using AI. And I think everybody knows that AI and basically using AI and NLP as a conversation agent, as a chatbot to provide access to early stage support, which is clinically assured, which is affordable, which is scalable, and which can actually be flexible enough to embed itself into different care ecosystems when you work with different partners. We started life as a B2C platform, and then, of course, now we started working with enterprise partners across the world. The platform has three different layers to it. And initially, when we started, obviously, the idea was to provide this as a go-to tool as a 4 a.m. friend. There is a chatbot which you can talk to. A lot of people, obviously, there is huge amount of stigma when you start talking about mental health. People don't know what to say. People don't know whom to reach out to. And even if they did, they don't want to reach out because they feel scared of showing and being vulnerable in front of another human being. And what we found paradoxically or counterintuitively was that actually people like the idea of talking to a chatbot, especially when they're anonymous. And now I think Wysa has been live for 4 years. We have 2.5 million users, and we've had more than 100 million conversations on the platform. And across the board, what people have told us is that they find the experience empathetic. They find that it's easy to talk to, and they're not being judged because there's no human being at the other end. So that's the core layer of the program or the platform, which is the early intervention using an AI chat platform. Depending on what the user is looking for, then he or she gets escalated into digital self-help tools. And these are in the form of a library where you can have lots of different techniques, cognitive behavioral therapy, DBT, mindfulness, visualizations, meditations, and so on. And all these are on a self-serve basis, so people can actually reach out and get help when they need to. And if they have the need for more advanced support, then the escalation happens to a layer of human support. So we have wellness coaches and who provide text-based therapy. The entire platform is anonymous. I think is one of the big reasons why we have seen such dramatic adoption across the world. So I think around 15% of our users are from India, but otherwise this is more like a made in India, but for the world kind of product. So we have users now from more than 60 countries. And over time, what has happened is we started life as a B2C platform. And then I think because of COVID, everybody knows people who are socially isolated, who are going through financial anxiety, health worries about the future. And, I have gone through it myself. I'm sure some of you have as well. And what has happened is I think we have seen a huge surge of interest from enterprise partners from across the world. So now we work with more than 10 healthcare systems and healthcare partners from Singapore, UK, Canada, the US, and India. We work, for example, I'll take some examples of the people. So now Wysa is the number one app for COVID anxiety in the NHS in the UK, National Health Service. It is being offered by Aetna for the private medical insurance business for its members across the world, both the digital and the human support layer. It is being offered as a national service, national rollout for the Ministry of Health in Singapore, where Wysa is now being offered as a mental health service, early stage intervention for all Singaporeans. And I think in our journey from B2C to enterprise and now more into clinical adoption, we are now doing 4 clinical trials with universities across the world. We're a Class 1C medical device, and we've also published proof of efficacy in JMIR, one of the large e-health journals in the world. And we're about to also publish something in maternal mental health. So that's kind
Ramakant, sorry, and you are in much demand. I'll tell you. I think even in the previous speakers on the stage were talking about the mental health, how, and it's one of the, besides the COVID pandemic, anxiety, mental health is another major pandemic, which is a kind of a byproduct of this COVID pandemic. And you will definitely be on demand, and we would like to connect with you and get to know and see how we can actually bring it to a larger population, because
Mhm.
everybody needs some kind of a easier solution. So thank you so much for being with us, Ramakant, and we look forward to be working with you. Okay.
Thank you. Thank you very much.